An 11-month-old child with cleft palate, developmental delay, and progressive macrocephaly is referred for imaging. I am showing you an unenhanced axial CT of the head. Describe the findings.
Let's see. Yes. The axial CT demonstrates significant enlargement of the posterior fossa. This is associated with hypoplasia of the cerebellar hemispheres and an absence of the cerebellar vermis. Furthermore, there is a large CSF-filled posterior fossa cyst that appears to communicate directly with the dilated fourth ventricle. Moderate supratentorial ventriculomegaly is present, and a ventriculoperitoneal shunt catheter is visible in the right lateral ventricle, indicating treatment for hydrocephalus. Overall, these features are diagnostic of a Dandy Walker malformation.
How would you differentiate a Dandy Walker malformation from a Dandy Walker variant and a megacisterna magna?
The Dandy Walker variant is a milder form that does not feature enlargement of the posterior fossa or elevation of the tentorium. In the variant, the posterior fossa cyst is smaller, and the cerebellar vermis is hypoplastic rather than completely absent. On the other hand, a megacisterna magna is simply an enlarged cisterna magna that communicates with the subarachnoid space. Crucially, with a megacisterna magna, the cerebellar vermis and hemispheres are entirely normal, and it is not associated with hydrocephalus.
I have now placed arrows on the same CT scan. What do they highlight, and what other anomalies are classically associated with this condition?
The arrows highlight the key pathological features we discussed: the widely separated and hypoplastic cerebellar hemispheres, the massively dilated fourth ventricle, and the large posterior fossa cyst. In addition to these findings, Dandy Walker malformations are strongly associated with other central nervous system anomalies, most notably corpus callosum dysgenesis, which is found in up to a third of cases. Other associated CNS anomalies include holoprosencephaly, gray matter migration anomalies, and cephaloceles. Outside the CNS, it can be associated with cleft palate, as in this patient, as well as polydactyly and cardiac defects.
If we were to obtain a sagittal MRI, what additional anatomical features would you expect to see?
On a sagittal MRI, a hallmark feature of Dandy Walker malformation is the marked elevation of the tentorium cerebelli and the torcula. The sagittal plane also clearly illustrates the massive cystic dilatation of the fourth ventricle extending posteriorly, which confirms the diagnosis.
How would you manage this patient as a radiologist?
As a radiologist, I would recommend comparing these brain CT images with any prior prenatal ultrasounds or fetal MRI to understand the temporal evolution. I would also suggest checking the positioning and function of the ventriculoperitoneal shunt on all follow-up scans. Furthermore, I would recommend a complete MRI of the brain and spine to screen for the associated CNS anomalies we discussed. Finally, I would ensure the patient is referred to pediatric neurosurgery and clinical genetics.